Pregnancy transforms your body in incredible ways. But let's be honest, it can also leave your arms aching, your back sore, and your posture struggling to keep up. In this video, we're diving into simple, safe, and powerful arm and back exercises for pregnant women that can make a world of difference. Whether you're in your first trimester or counting down the final weeks, you'll discover moves that ease tension, boost strength, and prepare you for the demands of motherhood, including one of my absolute favorites: the tricep stretch with a towel, a game changer for tight shoulders and tired arms. No gym, no problem. These exercises can be done anywhere, anytime, with little to no equipment. Stick around, because in just a few minutes, you'll have a routine that keeps you feeling strong, supported, and ready for whatever this journey brings. But before the video starts, write in the comments, from where you are watching this video. Thank you. Pregnancy is one of the most remarkable transformations a human body can undergo. A time when every system in the body adjusts to support the growing life within. And while the emotional journey often takes center stage, the physical one deserves equal care, particularly when it comes to maintaining strength, flexibility, and posture in the muscles that bear the greatest load. For many women, the arms and back become unsung heroes during this period, silently carrying the weight of daily life while adapting to the postural changes brought on by a shifting center of gravity, expanding ribcage, and the natural hormonal effects on joints and connective tissues. Focusing on arm and back exercises for pregnant women is not merely about staying active, it is about enhancing comfort, improving stability, and preparing the body for the physical demands of childbirth and the months of newborn care that follow. The arms, from the delicate wrists to the powerful biceps and triceps, play a vital role during pregnancy, not just in carrying groceries, lifting toddlers, or managing household chores, but in the future task of holding, feeding, and comforting a newborn for hours each day. The back, particularly the upper and middle sections, becomes a pillar of support for the entire torso, helping to offset the increased forward pull caused by the growing belly. Without intentional care, these muscle groups can become tense, fatigued, and prone to discomfort, leading to a cycle where poor posture fuels further muscle strain, and muscle strain, in turn, worsens posture. Gentle yet targeted exercise becomes the bridge to breaking this cycle, allowing pregnant women to move through their days with more ease, less pain, and greater confidence. One of the most overlooked benefits of incorporating specific arm and back movements during pregnancy is their role in maintaining proper breathing mechanics. As the baby grows, the diaphragm has less vertical space to expand, and this can lead to shallower breathing patterns. Engaging the back muscles and opening the chest through exercise helps keep the rib cage mobile, making each breath deeper and more efficient, which benefits both mother and baby. In addition, stronger arms help reduce the load on the lower back, because everyday tasks can be performed with better upper body support, distributing effort more evenly throughout the body. Among the variety of movements suitable for this stage of life, the tricep stretch with a towel stands out as a deceptively simple yet incredibly effective choice, one that requires minimal equipment yet provides maximum benefit. This stretch targets the often neglected muscles along the back of the upper arm, which tend to tighten from repetitive actions like typing, carrying bags, or even sleeping in a curled position. Performed correctly, it not only improves flexibility in the triceps, but also gently opens the shoulders, lengthens the sides of the torso, and encourages upright posture. For a pregnant woman, who may already feel her shoulders creeping forward as her belly grows, this can be a small daily act of physical relief. To perform the tricep stretch with a towel, start by choosing a towel long enough to hold comfortably in both hands without forcing the shoulders into strain. Standing or sitting tall, place one end of the towel in your right hand and lift it overhead, bending your right elbow so the towel drapes down your back. With your left hand, reach behind and grasp the lower end of the towel, gently pulling downward to stretch the right triceps. The pull should feel like a lengthening from the back of the arm through the latissimus muscles along the side of the back. Hold this position for several deep breaths, focusing on releasing tension with each exhale, before switching sides. This stretch can be easily adjusted for comfort, which is essential during pregnancy, when flexibility varies greatly from one day to the next. Beyond isolated stretches, pregnant women benefit immensely from combining static holds with dynamic movements. For example, after performing the tricep stretch with a towel, one might follow with a series of gentle arm circles to keep the shoulder joints lubricated, or seated rows using a resistance band to build strength in the middle back. The beauty of such routines lies in their adaptability. They can be done at home, at a park, or even in a quiet corner of a prenatal yoga class. With no need for heavy weights or complex equipment, the priority is always comfort, control, and mindful breathing rather than intensity or speed. Strengthening the upper back is particularly valuable for counteracting the forward slump that so often accompanies pregnancy. Simple exercises like wall slides, where one leans against a wall with the lower back gently pressing in and the arms sliding up and down in a goalpost shape, can train the postural muscles to stay active. These small corrections add up over time, making it easier to stand tall, which not only looks more confident, but also reduces strain on the lower back and hips. Pairing these strengthening moves with stretches like the triceps stretch with a towel creates a balanced routine that keeps muscles both strong and supple, a combination that is essential for lasting comfort. It is worth noting that exercise during pregnancy is not a one-size-fits-all prescription. The safety and suitability of any movement depend on factors like the stage of pregnancy, the individual's pre-pregnancy fitness level, and the presence of any medical conditions or pregnancy-related complications. Consulting with a healthcare provider or a prenatal fitness specialist is always the best first step. Once cleared, the goal is to create a consistent, enjoyable practice that supports both physical and mental well-being. Consistency, even in small amounts, is far more effective than sporadic bursts of activity followed by long gaps. A 10-minute daily routine that includes arm and back exercises for pregnant women can be surprisingly powerful in maintaining mobility, preventing aches, and boosting energy. The emotional benefits of maintaining such a practice should not be underestimated. Pregnancy often comes with emotional ups and downs, influenced by hormonal shifts, physical discomfort, and the weight, both literal and figurative, of preparing for a new life. Movement becomes a form of self-care, a way to connect with one's changing body, rather than feel at odds with it. The rhythm of controlled breathing, the sensation of muscles working and releasing, the awareness of posture, all of these bring the mind into the present moment, easing anxieties about the future. Something as simple as holding a tricep stretch with a towel can become a mini meditation, where the focus shifts from external worries to internal awareness and gratitude for what the body is accomplishing. Of course, no discussion of arm and back exercises for pregnant women would be complete without acknowledging the practical payoff after the baby arrives. New mothers often find themselves lifting a newborn dozens of times a day, holding feeding positions for extended periods, and leaning over cribs or strollers. Without strong arms and a resilient back, these repetitive motions can quickly lead to fatigue or injury. By building strength and flexibility during pregnancy, a woman not only supports her current comfort, but also invests in her postpartum recovery. She enters motherhood with a body better prepared to handle its new workload, reducing the risk of strains and making the physical side of caregiving more sustainable. Even for women who did not exercise regularly before pregnancy, starting with gentle movements now can yield noticeable benefits. There is no need for high-intensity routines or complex choreography. The focus is on mindful movement that respects the body's signals. This could mean starting with just a few repetitions of a wall push-up to engage the chest and triceps, or holding a seated spinal twist to ease tension along the back. Over time, as strength and comfort increase, more variety can be added. The triceps stretch with a towel might be paired with side bends, shoulder rolls, or gentle cat-cow movements on hands and knees to keep the entire upper body engaged. The body is already working harder than usual, building a human being from the inside out. And the role of exercise is to support that process, not compete with it. In the end, the benefits of arm and back exercises for pregnant women extend far beyond the muscles themselves. They influence posture, breathing, comfort, confidence, and even emotional resilience. A simple tricep stretch with a towel can serve as a reminder that caring for oneself is not an indulgence but a necessity. One that has ripple effects on the health and happiness of both mother and baby. This is a time to move with intention, to strengthen what supports you, and to honor the remarkable work your body is doing every day.